A PR-4 report is a comprehensive summary of the injury consequences that result in symptoms and, importantly, functional limitations and objective physical exam findings. Now, this also includes any diagnostic tests, surgical procedures, or interventions that were performed throughout the case management. Now, the findings of these reports are calculated to determine the ultimate loss of the whole person function. And in the AMA Guides 5th edition, which we use in California, that's known as the whole person impairment. And you're going to see that word in the report either as WPI or WP, depending on what you're reading. Now, this report has some key elements. Listen up carefully. Here's what's in this report. Number one, the report is going to outline the future anticipated medical care to maintain the best function for the patient. So this might include medications, physical therapies, injections, diagnostic tests, referral to specialists, and or maybe a special procedure that either the patient didn't want to need or they don't need right now, but they might need in the future, like a total knee for someone who has severe arthritis. Maybe they're too young, but when they get old enough or the symptoms get worse, they might need that total knee replaced. So that's called future care. Number two, apportionment. Apportionment is a little confusing, but the basic concept is pretty simple. It just determines how much of the functional loss at the time of the rating is due to the referenced work injury and how much of this loss is due to other factors, such as a previous injury or arthritis that the patient had or other medical conditions. Maybe they had rheumatoid arthritis or underlying diabetes that contributed to their carpal tunnel, that type of thing. So typically, they're pre-existing conditions not related directly to the work injury. That's called apportionment. Now, there's also an additional determination called a pain add-on, and this is whether or not the circumstances of the impact of the injury has resulted in additional pain that's not exactly and perfectly captured by the rating, and that's called a pain add-on. So in California, the doctor has to determine if, in addition to the usual rating, is the patient's condition such that they are maybe going to get a couple extra points, up to 3% of whole person impairment added on for extra pain. Okay, now the last part of the PR-4 report, and a very important part, is the permanent functional limitations. Now, we often refer to these as work restrictions, but really they're functional limitations. And so this basically says and tells all the stakeholders going forward, what are the permanent limitations of this person at work? What can they lift? How often can they reach? How long can they stand? Can they crawl? Can they be in certain environments? Can it be, certain temperatures they have to be in, uneven terrain, all of these things. Now, why is this so important? And this gets missed often when you're going to sit the patient down and have a discussion that they are at maximal medical improvement. If they are going to walk out of that office with permanent functional limitations, you have to explain to them that the employer, when this report is done, has to determine if these limitations can be reasonably accommodated on a permanent basis. If they cannot, then the employer may have to release the injured worker from their job. And so that is a very, very big deal, because the injured worker may have been on modifications for months and in some cases years, but as soon as those restrictions change from temporary during the active treatment of the case to permanent, because now we're talking about permanent impairment and a PR-4 report, these things become permanent, and now the employer has to make a determination if they can keep this employee on. So it's a pretty big deal.